Welcome to the Cardinal Minute with your host and chair of the University of Louisville Department of Medicine, Dr. Kim Williams.
Well, good morning and welcome to a Cardinal Minute. I'm Dr. Kim Allen Williams, chair of medicine here at University of Louisville. And it was my pleasure to introduce to you Dr. Dinesh Kalra, who is professor of medicine and radiology and our chief of the division of cardiovascular medicine, who gave us spectacular grand rounds this morning entitled New Advances in Dyslipidemias. Please, Dr. Kalra, if you will, summarize your grand rounds in the next minute.
Absolutely. I think lipid management has become such an important part of comprehensive risk reduction for both patients in primary and secondary prevention. And after about 3 decades of relatively little progress and having very few agents to treat risk in our patients, now we have an explosion of pathways and drugs to treat our patients. So I talked about risk refinement, risk assessment, and the use of these newer compounds in not just treating patients, but also in figuring out which patients are the appropriate patients for these kinds of treatments. So we discussed triglyceride-rich lipoproteins, lipoprotein little a, the diminishing importance of HDL cholesterol, which for a long time we had all been hung up on, and genetic data that's coming out showing why these other markers, such as angiopoietins, are also important in cardiovascular disease. And then I talk about the new drugs that are coming up and exciting therapies such as CRISPR and vaccines and oral PCSK9 inhibitors. So literally the field is expanding with plenty of options. And I'm just so delighted that our patients now have more than one option for cardiovascular risk reduction. But at the end of the day, I emphasize that diet and exercise, especially a plant-based diet, still forms the cornerstone for risk reduction. So it's not like you can take a medication and do all the wrong things outside of that.
That was so comprehensive and so educational. Thank you so much. And hopefully everyone gets the idea that we have a field that's moving along, but yet we're always starting with lifestyle. Thank you so much, Dr. Kalra.
My pleasure.